Good morning, good evening. It's absolutely a pleasure to really have you here with us for this very, very interesting interaction that we are having. And uh, as part of the series, what we call as the uh, global partnership, or what we are calling as the Global South partnership that we are creating, or a research partnership that we are creating between Institute for Competitiveness and PATH. And like what was the rationale in terms of wanting to do this partnership? That is what I would like to talk to you first, and then I'll of course talk about the webinar today. But while the global pandemic happened about a few years back, what we could see was we could understand the fault lines that possibly existed across the world in terms of how the challenge was happening, how the countries were actually facing certain sets of issues, and then, of course, it became fairly clear that road to equity and resilience in public health systems would require more than just an intention. It was going to require a concerted effort or innovative solutions for the world to solve the problems. And as we were really looking at this, the question was, can we really create something very powerful as a network to really get all the conversations together, to really get ideas together? And how can we do that? Can we really get people like, say, Path on the board? How do we get people like SEPI on the board? Or there are many experts across the board who have been doing some immense work. So can we document this body of work? And if you're able to document this body of work, and if you're able to document the innovative solutions that have actually happened, can we really tell the world that you can learn from us? Because if you really look at the world, and as we look at it, or at least as I look at it, who's been working in the area of global health or strategy, competitiveness, the idea was that, like the solutions for the world tomorrow are not really going to come from the West. They're effectively going to come from the global South or countries like India, Africa, and so on and so forth. And this was also exemplified by some of the very powerful examples that we can see over the last 5 years. One of them was in India itself, the PPE equipment, or what you call as the personal protective equipment that was actually coming through from India. It was an immense positive thing that had actually happened. We've also done a study on that, but that's a separate issue. Then, of course, what India was able to do through vaccines and vaccines in terms of India in itself, if you really talk about it as a country, was able to give vaccines to over 1 billion people and at fairly quick pace. And it is not that just India did it, the global South did it. Because the kind of economic impact and the social impact this pandemic could have actually had was mitigated by some of the smart solutions that the world was actually looking at. And if you really look at countries like Rwanda, they did a very important thing over the past few years, and that's about robust health strategy or a digital health strategy. We've had Brazil doing some interesting things. You have had South Africa, where the government had partnered with local manufacturers to produce medical supplies, etc. So there are many, many valuable lessons that actually come across and that can be drawn from each of these countries. And it is important that we draw this and document all this effort and really share the ideas to the world. And as we were going through this whole set of discussions, we said we are going to create a collaborative. And this is where PATH and Institute for Competitiveness are collaborating. Incidentally, PATH, everybody knows here on the platform. From my point of view, I think PATH has been one of the most impactful what I call enterprises or initiatives in the world, especially if you really talk about India. What they've been able to do with rice fortification is absolutely commendable. And the kind of impact it actually has on health of people, reduction of anemia, etc., is very, very powerful. And I think this is where we need to understand and document efforts of enterprises like PATH as well. PATH is not alone in this journey. You have had other people across the board, and which we need to really learn and appreciate from. And as Institute for Competitiveness, we are a research think tank, which is an affiliate of the Institute for Strategy and Competitiveness at Harvard Business School. And this is the institute that I chair. And at the institute, we have fundamentally been saying as to how do we talk about social development and economic development, which is able to go hand in hand. There is a very clear evidence which is available, which says that when social development has actually happened, only then economic development will go forward. Just as a case in point, not talking from health, but just as an academic exercise that we have done, like for every additional year of schooling after class 8, if that actually happens in India, the income levels increase by about 10,000 rupees per year. So what it shows is that investing in social infrastructure can have a huge impact for the future. And that is what needs to be done. And this is where Institute actually comes in to really provide evidence and assess as to what can actually happen at smaller levels of geography. The Institute works across the board on these issues. So I'll not talk more about the Institute, but about the idea itself. And when we were saying that let's create this idea of Global South Research Collaborative, what is it that we were wanting to achieve? So there were about three things that we felt are going to be the mainstay pillars of what we have to do and what we want to do. One was, of course, develop a comprehensive knowledge hub. And that knowledge hub is going to be about creating a central repository of research, of best practices, the innovations that have actually happened in the area of health, and that can get replicated across the board. So, and this hub has to include what I would call as, say, ideas about health technologies, digital health solutions that have been used or that have been implemented across the world. Possibly cross-country comparative analysis, issues in terms of aggregating and analyzing health data and research. There is so much to learn from all this data that exists. So if you really look at how things have happened in India from NFHS 5 or NFHS 4 and the kind of variation that have happened, it actually tells us some set of stories. It gives us positive stories, the negative stories, but the data does tell us something very, very important. And this does happen across the world. The second idea was that we should look at facilitating expert engagement and collaborations. And this is what we are effectively doing today, wherein we want to have experts to really come in together and talk with us and really become a learning platform. So this is where we said, okay, now let's do some events together. And when I say event, it's not just an event. It's not a celebration or whatever, just to have people together in sponsorships or whatever. It's about an event about knowledge sharing. As an academic, I firmly believe that the world goes around when we are able to share knowledge with each other. And how do we make this knowledge as a public good? So the initiative, as you really look at it, is about creating public goods that are able to be used across the world. And this is also going to be about fostering those cross-sectoral partnerships that we are able to do. Can health learn from something else or some other sector? Can some other sector learn from health? Because if we are able to create these documentation, we are able to document the best practices, we are able to share those best practices. And then, yes, of course, there is that whole idea of the Medici effect that can happen. And when I'm saying that there is a Medici effect, what I'm saying is that how that cross-learning would happen and create those multipliers. I'm absolutely certain that the multipliers that can happen through this kind of an initiative are tremendous. And I would always say direct, indirect, and induced impact of all these initiatives are very, very powerful. The other thing that we wanted to look at was promote and share innovations in health, especially. And it is not only about innovations in terms of, say, delivery, it is also about innovations in terms of, say, business models or what you would call as delivery platforms. Advancing digital health, we have had some very interesting set of ideas within the country in terms of advancing digital health and across the world. So how do we look at this? So some of the work that we are envisaging to do together at this point in time is about innovation in healthcare, ideas of country-specific roadmaps, the Global South Pandemic Preparedness Index, because we do not know when the next pandemic is going to happen. Well, what happened to us was effectively hitting a wall, and that was just absolutely a stunning experience, or a mind-blowing, negatively mind-blowing experience, as I would say. Can we look at, say, vaccine development source book or climate and health strategy or synergies that can actually happen together and so on and so forth? So it's about the outcomes, if I might say. The outcomes are going to be about documentation and knowledge building, very, very clearly, expanding partnerships as we really look at it in the world, possibly providing. The third pillar could be evaluating and strategic planning beyond health over a period of time. And we are not looking at this partnership as a singular year partnership. We want to look at it as a multi-year effort. And when I'm saying a multi-year effort, I think this is an effort which can go on for decades, because if you're able to create some positive research and which can create impact is going to be very important. And as you know, one last point that I would like to share here is that if you want to make a difference especially in the policy space, especially in the thinking space, then research has to be a continuous effort. Research is going to be a center stone or the cornerstone of creating new set of ideas and really pushing it into the public space for creating solutions for the world. And this is what it was. And in light of this, what we are doing today is starting or kicking off this platform. And I have to thank two or three people. In fact, one of them is absent, conspicuous by his absence. But then I think I have to get near, even with him at a different stage because he's not present here. And his name is Neeraj. I think you all know of Neeraj. He's just absolutely not here, but somebody who started or sowed this idea in terms of what we need to do. But then Ankur, and you can't really ignore Ankur here. For a simple reason, Ankur and I thrashed on this idea for weeks as to what needs to be done and how we can create a powerful platform. So Ankur, thanks for being such a great partner, for really concretizing what we want to do and what we wish to do and what we wish to achieve. And of course, my team here at the Institute for Competitiveness, which includes Neera and everybody else, which is going to be core part of what we are able to do with research. But for today, what we are doing is that we are starting this Simplified series, and I'm sure you've read the note that came across to you. But what we are talking about is like how to make these ideas accessible to the world. And what we are going to talk today, in fact, as I was talking to Ankur, I was surprised to know that possibly 60 to 70% of the people who are working within the space of health do not know what pandemic accord is. And possibly 99% of the people on the street don't even know what pandemic accord is. I don't even think they would have actually heard of it. So, this becomes very important as an element that needs to go out to the world, and we should talk about it. And so without further ado, I've already spoken for too much time, but without further ado, I must introduce you to a very important person here. You know Ankur fairly well. Ankur is affectionately a PhD. In fact, we were talking about the whole huge process of PhDs, but again, that's his jokes apart, but he's somebody who's a PhD just like me. So he is Director of Strategy and Partnerships and Communications for South Asia for PATH. Before this, he was actually with CEPI. And this is where he was looking at or working with the policy team and the partnership team together. In fact, I was just trying to get a feedback on him from Naren. And Naren just said, like, he was the boss. So Ankur used to be the boss who would actually just bamboozle things around or whatever. And I've seen that happen. But an amazing personality. And he's somebody who's really worked across the lower and middle income countries and has had the responsibility of designing and implementing strategic roadmaps to engage with Global South. So he comes with a very interesting view to the world. So Ankur, without further ado, I think I am between you and this conversation. So Ankur, I would request you to actually go ahead and talk about pandemic accord here, simplified version of the whole idea, and you have exactly 25 minutes. Over to you, Ankur.
Well, thanks very much, Amit, for that kind introduction. And nobody's boss in my mind, and I think that's the whole idea of being equitable, being open, and actually having that inclusivity for the global South. As Amit mentioned, I feel very passionately about empowering the global South, and this idea came up and got polished between Amit and myself for several weeks, and it took quite a lot of hard work to launch the platform today that we've put together in a very tailored format. So thank you everyone for coming, for joining us. I see we have quite a lot of attendees, so I won't waste any more time. Amit, if you can just give a quick shout out that you can see my screen, and I'll start talking about the slides.
Yes, please. We can see your screen. And of course, we saw your emails just before that.
Thanks. Okay. I mean, there was nothing classified in that. So I work in a very open manner. So thanks. Right. Pandemic Accord Simplified, as part of the Simplified series of the Global South Research Collaborative, is really an idea to project to all of you today what Pandemic Accord is all about in the most simplified manner possible. I mean, it is a complex policy piece which is currently being discussed in the WHO quarters along with 194 member states. So it is something that can get very, very complex for most of the people. Forget global south stakeholders, but a lot, and actually I should say most of the global north stakeholders also who I've talked to have also come across as having limited knowledge of what Pandemic Accord is all about. So I think the idea here is to simply give you a picture of what the complex policy is, and so that you can then start thinking about it, start talking about it in your circles, and therefore start championing the idea of contributing to such major policy pieces that will have a large impact or large positive impact, I must say, on the global south during the next crisis as the world prepares for it. Before getting into the actual content, I would like to highlight this disclaimer that there are ongoing discussions on the Pandemic Accord as we speak. Therefore, the content of this document, which has officially been compiled, which has been compiled from officially published documents, open published commentaries, and journalistic assessments, is only for educational purposes, and it doesn't by any means imply endorsement by either PATH, IFC, CEPI present here, or any other partners who have contributed to making this idea a reality. The document also does not intend to discriminate against some of the stakeholders whose comments may not have been included in the preparation of this document. We've tried to be as inclusive as possible, but the public open world is big and wide. We may have missed some here or there. Also, please note that the comments and quotes highlighted in this document are non-exhaustive and indicative only, and some of them may have already been acted upon. So it's important that you realize that those were the quotes made at different stages of the Pandemic Accord negotiation process. Users are also encouraged to use your own discretion as you seek more details and more information on the topic. You're always very welcome to contact us and our team if you needed any more details. We'll be happy to provide. But for sake of time and for sake of simplifying such a complex topic, we've tried to squeeze this into a few slides here. I would like to start with the background of how the Pandemic Accord idea came up. I mean, I don't need to introduce anyone to what happened during COVID-19. It really shook the world. In 2019, when there were some cases of pneumonia that were pointed out to in Wuhan in China, that followed by a novel coronavirus outbreak being declared as a public health emergency of international concern by the WHO in late January. By April 2020, there were over 1 million cases. Act A was launched, which was accelerator for COVID tools, and medical oxygen was also added to that as fourth pillar, because we knew that the preventative measures may not come through as quickly. Therefore, some treatment measures in the form of medical oxygen would be absolutely critical. By September 2020, over 120 million affordable and quality rapid test kits were made available for low and middle income countries, which was a feat in itself as the whole world came together to respond to the crisis. And again, for once in a lifetime, we saw a vaccine being launched in 2020 December, followed by many other vaccines. So some of the vaccines launched were Pfizer, AstraZeneca, and Moderna. So within a year or less than 365 days of the pandemic being declared, or the outbreak being declared as public health emergency of international concern, a vaccine was available, which is really kudos to the whole world. In 2021, COVAX was signed because the world started to see the signs of how divided the access was across the world, and therefore, as a measure to address that quick failure that was identified, COVAX was signed as an immediate success step that was taken. COVAX was co-founded by CEPI, from where Naren is, who you would hear from, Gavi, WHO, and UNICEF. And the idea was to really supply the world in a very equitable manner with the doses of vaccines, as some countries were really struggling to get their hands on vaccine doses when the whole world was grappling with this problem. In April 21, over 100 economies received vaccine. Moderna COVID-19 vaccine also got WHO emergency use approval. In September 2021, WHO Hub for Pandemic and Epidemic Intelligence was launched. And then in 2022, February, Omicron variant, which is now present in almost everywhere in the world, was the one which entered our lives. It has potentially evolved into many other versions. After a point, the world sort of stopped tracking. As you would remember, we followed quite a lot of variants for a while during the COVID lockdowns, etc. In May 2022, approximately 15 million direct or indirect deaths had happened. Southeast Asia, Europe, and the Americas accounted for 84% of the excess deaths. So it's really startling how many people died in a short span of time. And on 5th May 2023, COVID-19 was declared as over in the form of a public health emergency. So that was officially announced as an end of the public health emergency, but the disease sort of lives on in our world as an endemic disease, as we know. But hopefully we are all vaccinated, and we've all got some natural coverage through natural exposure as well, and we're fine. So as a result of COVID-19, World Health Assembly started discussing what can be done about it. And there was an independent panel for pandemic preparedness and response established in 2021, which started calling for evidence-based solutions for future health threats. IPPPR also submitted its report on COVID-19, and the report was called Make It the Last Pandemic. And the report was launched in World Health Assembly in May 2021. That was the first time a pandemic treaty was called, or an action to form a pandemic treaty was really called. Another couple of actions that were called were a more focused and independent WHO, who were preparing a critical role in the pandemic preparedness and response, and also formation of a senior global health threats council. World Health Assembly then, to follow up on its commitments, established an intergovernmental negotiation body, INB in short. You would hear about this quite a lot throughout the presentation. And INB was established to draft and negotiate a WHO convention, agreement, and other international instrument on the pandemic preparedness, prevention, and response, essentially in the form of a pandemic treaty, or in other words, pandemic accord. The body now represents all the regions of the world, aims for adoption under the Article 19 or other provisions of the Constitution of the World Health Organization. So the need for pandemic accord needs to be re-highlighted why the world came up to this idea. COVID-19 was a really decisive pandemic. It showed the gaps in equality and equity around the world. Public health systems were really super stretched. Fragile food systems were laid bare open. Economic and social instability added to the misery of the world. WHO member states therefore initiated the process to reinforce cooperation among all the global member states of the WHO and other countries, improving the coordination between all the parties that have to interact in such a crisis, enhancing the transparency in dealing with future pandemics, ensuring fairness in access, and making access to healthcare a core part of this new accord that had to be drafted at the time. So INB and its bureau was therefore set up, and the bureau's governance or high-level governance is really formed of 6 officers, one representing each of the 6 WHO regions around the world. And the idea there is essentially to design and implement the proposed process for the negotiations among the 194 member states of the World Health Organization, get complementary inputs through public hearings with stakeholders. This is how you attending this seminar can also start contributing to the process and making your inputs. International organizations, civil society, private sector, and other entities were also consulted as part of the process. Sorry, staying on this slide, in INB's second meeting, the Bureau was really, at this particular time, was requested to develop and present a conceptual zero draft of the accord, and multiple convenings have taken place since. I must say that the pandemic accord discussions have advanced to quite a late stage now, and the advancement has been really steady and really positive. You'll hear more about how it has advanced as I speak about it. So in March 2020, when the pandemic was really in its early days, 25 heads of state came together for a joint call for pandemic treaty. And that's when IPPPR called for a pandemic treaty. And then G7 and those 25 heads of governments really decided that we need to launch an international treaty which will start to address these kinds of crises better. Therefore, a special session of World Health Assembly was called, which I talked about in one of the previous slides, and an intergovernmental negotiation body, or INB, was set up at that time for delivering the pandemic accord or pandemic treaty. Discussions on the topic resumed between February and June, and 6 Bureau members were elected. Digital platform was established, public hearing, consolidated draft. Everything happened between Feb and June 2022. And in July 2022, a working draft was tabled. Provisions of WHO constitution were identified so that the progress can be made on the working draft. Conceptual zero draft was really tabled in December 2022, and consolidation of inputs was made during this time for the first time. And then in February to June 2023, zero draft was actually developed. INB drafting group was formed, and the Bureau's text was officially submitted to the member states for further review, and the review then continued in the same time period. September 23, closed meetings with various members on various articles of the draft accord took place, and in December 2023, drafted proposal for negotiating the text of WHO pandemic agreement was made open for negotiation, which is when the negotiations started in 2024, where they advised to submit a revised version of the draft, and the 9th INB meeting took place. From March to May 2024, there was a decision to submit a draft report to World Health Assembly, and modalities of the engagement of relevant stakeholders was decided at that time. And in July 24 and then September 24, some more negotiations have continued, and the pandemic accord text has further evolved quite a lot in the process. Now, the structure of the latest draft broadly includes 3 chapters. The first chapter includes the use of terms, so all the key terminologies used in the text, objectives and the scope, general principles and approaches. In chapter 2, which is the bulk of the text to address the inequality, and everything that we saw during COVID, is incorporated. And in chapter 3, there is text on the governance of pandemic accord, and other legal issues have been highlighted in chapter 3. Now, what are the major discussion points of the accord? There are 8 major discussion points of the accord. One of them is coordination and cooperation, where there's a mechanism being established for states and WHO to coordinate in a pandemic or any other similar crisis that may happen in future. Another discussion topic is what should be the general and legal term, because it is important to have a preset legal framework available, so that in a crisis there is no legal debate happening and everybody has already agreed to some sort of legal terms and can quickly sign and cooperate. Governance, monitoring, and accountability systems are being set up as part of the process. Sustainable financing of crisis and in preparedness for the crisis is something that is taking quite a lot of attention in the document, followed by equity in supply chain management to ensure that even when the medical countermeasures do become available, there is a supply chain and equitable supply chain available to make sure that those countermeasures reach the needy. And then strengthening surveillance for responsive health systems, absolutely essential to get to that alert trigger to announce that as early as possible that there is a problem at hand and we need to respond to. And then technology transfer and information sharing becomes incredibly important because during crisis, anywhere in the world, technology to respond to that crisis may not exist at the source. So therefore, technology transfer arrangements or pre-agreed tech transfer arrangements have to be in place before the crisis response starts. And also there is a call for biomedical research and inclusive approach. So therefore, R&D and everything, all the preparedness that the world can do in readiness for responding to the next crisis should be done and sustainably funded in the process before the crisis hits. Now, the key areas of negotiation and bottlenecks of the process are global cooperation and political will. Many of you would have read in public fora that the positions of global south and the global north have occasionally been different. There has been a little bit of sort of differing ideation in several quarters of the negotiation panel, which are all being resolved to get to a text which is agreed by all. Just to highlight a couple of comments from the Third World Network that said that while developed countries demand legal commitments from developing countries ask the developed countries to undertake legal obligations to realize equitable access. So it's really important that both developed and the developing world has equity and equal say in the whole process, and everybody gains sufficiently in the form of responding to the crisis. European countries who led calls for pandemic treaty, this is from the Economic Times, want more money invested in the pandemic preparation, while African nations, and rightly so, wanted the knowledge and financing to make that work, because some of that did not exist in some parts of the world, and therefore proper access to pandemic countermeasures like vaccine and treatments was a call from African nations. Developing countries are also holding out firm on guaranteed equity, which is something that is being negotiated at the WHO table through the INB process. Now, important thing to remember is these comments might have come at different stages of different drafts. So therefore, some of these issues that people highlighted at the time may have been addressed, but this is just to show how passionately the world has been following this and commenting on this to make sure that the final outcome of the pandemic accord is really for everyone. Then there's a lot of discussion around governance for the accord, that there is some people think that the governance model is fractured, the compliance is largely dependent on the parties' desire, it excludes binding clauses, it excludes explicit obligations that can lead to accountability, and that there is no mention of the possibility of conducting an independent assessment. All of that was highlighted as the draft was progressing. Some of this has been addressed, some of this continues to be negotiated. And again, some more passionate comments from the likes of Gavi, Nina from Columbia University, and others have, been very candid in saying that, or actually Eva Bornhen, for example, criticized the pandemic treaty, one of the drafts of pandemic treaty, for not including clear incentives or disincentives for political leaders in the whole text. which all of these comments are being actively addressed as part of the process. Nina and colleagues said that governance and accountability mechanisms of the treaty are being further undermined as part of the process. Again, all of these very independent, very open comments coming in, and INB negotiations taking a careful note of these in their negotiation process. Gavi has called for a stronger collaboration with governments, civil society, and the private sector to really be the game changer of the PPR process. Thirdly, general comments. A lot of people think that there is the language in the draft is weak. There are very little hard commitments, concerns about the accountability, very similar to what was said previously. And again, Lancet, British Medical Journal, and the Dutch organizations and different global public health convention institutions, etc., have highlighted this in their own ways by publishing articles in peer-reviewed journals or writing commentaries in media as well, by highlighting some of the gaps that have to be addressed in the process. Then pathogen access and benefit sharing has been a key topic of discussion, where again some differences have been seen between the global south and global north, because a lot of countries don't feel comfortable sharing the pathogens without having a proper benefit sharing scheme in place in case vaccine was to be developed or diagnostics or anything was to be developed that could have not just economic benefit in terms of the actual gain, but also benefit in terms of responding to the crisis. So PABS, or pathogen access benefiting sharing, is another key topic of discussion as part of the negotiation process. As you would see, Thomas, who is the DG of IFPMA, said that PABS system should be established under the WHO, and this to really create a bureaucracy that would slow down production. So I think a lot of people are highlighting concerns around how inefficiencies could happen as a result of some of these schemes, and what could be done to alleviate some of those inefficiencies. Then One Health principles. For the first time, the topic of One Health is being discussed at this level.
Ankur, sorry for interjecting. 2 more minutes, please.
All right, thank you. One Health, for the first time, is being included in an international legally binding agreement. It's very important because a lot of diseases that have pandemic potential do come from zoonotic sources. So there's a lot of focus on One Health, and it's being legally embedded in the document. A lot of CSOs have called on negotiators to reject the One Health instrument in the pandemic agreement, because some of the sectors or some of the sections of the text do make a lot of civil society organizations or global south stakeholders uncomfortable. All the text is really available openly, and we will also share these slides with you with links to these texts. Sustainable financing, nothing moves without proper financing in place. So therefore, financing, not just for response, but also for proper preparedness, has to be in place, and Pandemic Accord is really discussing. Global Fund and other institutions like DNDI, and in fact CEPI, Gavi, everybody has been very vocal about the importance of having strong sustainable financing built into the document. Finally, in the last minute, how might the collaborative response to next health emergency look like if the accord is signed? The accord is really asking for establishing principles, priorities, and targets for PPR, for increasing resilience to pandemics, supporting prevention, detection, and response to outbreaks, making sure that there is equitable access to all the countermeasures that are developed in response or in preparation for the pandemic, and promote global coordination through a stronger, more accountable WHO, so that response could be fast-tracked during a crisis period. On the final slide, 11th meeting took place in September, as I showed in the timeline, and a lot of progress has been made in the process. Very recently, from 4th of November onwards, 12th meeting of the INB took place, and not a lot of details have come out from that meeting, but we are actively following the outcome of that meeting as well, and will be happy to share in due course of time. And with that, thanks very much. And back to you, Amit. Thank you.
Thank you. Thank you, Ankur, for this very comprehensive view on the pandemic accord. But I think without further ado, we need to move on to our next expert or a speaker. In fact, I believe he's one person who does not really need any introduction, and he's a real doctor. That's the first thing. The first two speakers were not the real doctors. So here is the first real doctor who's going to come and speak. So Edward is a medical doctor and a program management specialist who's going to make a comment on the pandemic accord. He's somebody who's worked in places like Kenya, Africa, etc. But then he's been part of monitoring and evaluation, so he understands the idea of pandemic and managing pandemics and looking at all these things very, very deeply. And he currently serves as programs director for PATH in Africa, especially Kenya. And he's also the regional service delivery technical advisor for PATH and many, many more things. So his CV is just way too long. So I think you should just look at the internet. But without further ado, can I request Edward to come in and share his views or reflections on the pandemic accord, and especially in light of what Africa, or in light of African view or the voice of Africa. Over to you, please.
Yeah, thank you very much, Professor Amit, for the kind introduction. Much appreciated. And I've been asked to speak on the reflections on the pandemic accord from the perspective of Africa, or the voice of Africa. I sit in Nairobi, Kenya. I practice in the Africa setting in Kenya and beyond the borders of Kenya within Africa, but serving also African populations. And as we discuss the pandemic accord, the precursor to this was COVID-19, and we all know what COVID-19 did to Africa. Next slide. So why is it important that we have the voice of Africa in this conversation? Professor Amit did allude to this, and he did say that the next big pandemic is on its way. And modeling studies have shown that we have up to a 50% chance that we'll have a pandemic as serious as COVID-19 happening within the next 25 years. And as has been spoken by Professor Amit and Dr. Ankur, it's likely to disproportionately negatively impact the low income countries, and in this instance, Africa. When COVID happened in Africa, we know the dynamics around how the response was, and largely we saw an haphazard response, and that was underpinned by a lack of transparency in data sharing and poor coordination. There was an element of vaccine nationalism, there was inequity and lack of inclusivity, and there's also the aspect of inadequate financial response for a comprehensive, coordinated response. And consequently, then the devastating socioeconomic consequences out of the COVID-19, and particularly in the low-income countries that have continued to experience depressed economies and delayed socioeconomic recovery. Next slide. So then, what are the things that we must do going forward? In that context, then we must improve surveillance, we must look at elements of diagnostics, workforce capacity, and the whole element of governance around pandemic preparedness and response that the previous speakers have spoken to. At the same time, we're also looking at strengthening the public health systems and engaging communities for more effective and harmonized pandemic response across Africa. And therefore, next slide, what is it that Africa must do? So again, homogeneity in structure and content. This really speaks to the aspect of sameness, and by implication, equity, which I'll speak to shortly. And therefore, the proposed pandemic accord is much needed, just so that we have sameness in terms of how we respond to pandemics, how do we prevent pandemics, and how do we prepare for those pandemics. And its form, content, and structure must not perpetuate the fragility and disparities as we saw during the COVID-19 pandemic, particularly in Africa. Consequently, equity is a key pillar of, is a key call out in the pandemic accord. And as has been spoken to, chapter 2 of the pandemic accord really speaks to equity. And this equity, we are looking at meaningful participation, but also co-creation for the pandemic prevention, preparedness, and response solutions that will include the pathogen access and benefit sharing that has been spoken to. And here we are looking at equitable and fair access to the pandemic-related health products and technologies. We're looking at the aspects of technology transfer and information sharing, We are looking at the elements of local biomedical research, but also looking at the elements of vaccine manufacture. Right now at about a paltry 1%, and we have a target of increasing vaccines that are locally manufactured in Africa to 60% by 2040, but also the element of affordable pricing. And for us to be able to achieve this lofty vision of the pandemic accord, and particularly for Africa, it calls for us to speak with one voice as one Africa, and therefore adopted the Common Africa Position on Pandemic Prevention, Preparedness, and Response in May 2023. This was really spearheaded by the Africa Union and the Africa CDC, really providing thought leadership and technical support really to come up with this Common African Position. And the whole idea is to strengthen Africa's negotiating position, the pandemic treaty, but also guaranteeing the continent's priorities are adequately reflected in the global pandemic prevention, preparedness, and response mechanisms. And as I close, then what has PATH contributed to in this space? The next slide. PATH has collaborated with the Africa Union, has collaborated with Africa CDC, and particularly the South African presidency, which has been the Africa Union champion for COVID, and this has transitioned now to Africa Union champion for pandemic prevention, preparedness, and response in facilitating efforts around the pandemic accord and designing the pandemic accord that aligns with the global health security strategies, but also in help in advancing a united and robust pandemic preparedness strategy for Africa. Some of that support by PATH has included support for policy, facilitating multi-stakeholder engagement, and supporting capacity building initiatives to improve resilience against future pandemics. So this is just a snapshot of what we've experienced in Africa and what we are looking forward to the pandemic accord that has been so eloquently spoken to by Professor Amit and Dr. Ankur. Thank you very much, and back to you, Professor Amit.
Thank you, Edward. This is very interesting. But let's move ahead on the conversation because I want to open this up for Q&A after the next speaker. So we have a guest here, Naren Rao, who is going to be sharing his views with us on the pandemic accord itself. So it is about his commentary, effectively, I must say, as an expert who's been looking at this whole area. So we wanted his views, and this is where Naren would actually come in. He is somebody who heads the policy team at CEPI, and he's somebody whose response to changing external environment and develops informed. That is what his CV also says. That's something very interesting. And develops informed, aligned, and robust positions on policy matters. And so that means like there is somebody who looks at everything very, very critically and wants to give you a certain view as to what the world is all about. But before joining CEPI, he was part of the MSD team and within the Sub-Saharan Africa business. But without further ado, Naren, can I actually request you to come and share your views or your commentary on the pandemic accord? Naren, over to you. And I'm sorry I've not been able to do justice to your profile and your accomplishments, but over to you here, please.
Thank you, Amit. Good day, everyone. CEPI is the Coalition for Epidemic Preparedness Innovations. We are a global partnership working to accelerate the development of vaccines and other biological countermeasures against epidemic and pandemic threats. Our strategy aims to reduce or eliminate the future risk of pandemics and epidemics, potentially averting millions of deaths and trillions of dollars in economic damage. Next slide, please. So here you get to know more about CEPI, and you get to know about the partners that we work with, the various constituencies we engage with. At the heart of our mission are two themes that we've discussed already in the preceding presentations. The first is, when we have a health emergency, speed is important. So in CEPI's mission, the word that I've highlighted for you today is accelerate the development of vaccines. Secondly, as we've also discussed repeatedly through the presentations this morning, accessibility is important. It's no use having a vaccine that's developed rapidly, but one that is not accessible to people in need, especially those in the global south, where we see most of our epidemic and pandemic threats emerging and even growing. So since our launch in 2017, we have invested in over 50 vaccine candidates or platform technologies and contributed to scientific breakthroughs, including the first licensed chikungunya vaccine, the first ever Lassa vaccine in phase 2 trials, the first Nipah vaccine in phase 1 trials. So with the diseases that I've just highlighted, you can appreciate why we have such a strong emphasis on equitable access in the work that we do at CEPI, and why it is, and you will start to appreciate why it is important for us not just to engage the scientific community on the speed aspect of our mission, but to engage the global ecosystem in terms of shaping and directing that ecosystem in a manner that encourages broader access for all. So the approach we take to the ecosystem we define as a systems approach. And this means to us and to our partners, we would hope, that all of us are responsible for a role in ensuring that equitable access is achieved when there's an outbreak, when there's a health emergency. However, taking a systems approach, I do want to emphasize, does not diminish the accountability of each of the organizations involved in health emergency response. Next slide, please. So we've jumped into the pandemic agreement this morning, but I do want to emphasize very briefly that there are two pillars to the global pandemic preparedness and response framework that guide countries, that guide the world. The one pillar we've already covered many times today, the pandemic agreement, but its twin in terms of the global PPR framework is the international health regulations. Now, while we continue to negotiate on the pandemic agreement, the international health regulations were agreed at the World Health Assembly earlier this year. So one aspect of the framework is in place, but the second, and for some, arguably more important aspect, the pandemic agreement continues to be negotiated as we speak today. In the interest of time, I'm going to skip ahead to the next slide and hone in on the pandemic agreement. So sorry, one slide back, please. What are our positions in terms of the pandemic agreement? Why is this important to us? And what are the positions that we've been advocating for over the course of the last 3 years, during which the pandemic agreement negotiations have unfolded? Firstly, as an overriding principle, we need to be clear on the roles and responsibilities that each country and each international organization has in terms of an equitable response to health emergencies. So as Ankur spoke to governance and emphasized the challenges relating to governance, this is the principle that underpins what we advocate for at the INB negotiations. There are three fundamental positions on a more detailed level that we have been directly and through partners advocating for. The first is sustained preparedness investments in research and development, and in support of this, ensuring that government R&D funding agreements, public funding agreements, include contractual requirements to support equitable access. So this is in line with the systems equity approach that I outlined earlier, where all of us have a role to play in terms of ensuring equitable access, and those involved in funding research and development need to ensure that their respective funding contracts have provisions relating to equitable access. Whether those provisions relate to an affordable pricing, whether those provisions relate to strategies for global south access, of which there are many, or any other innovative approach one may take to access, but it's important that we all row in the same direction, we all steer in the same direction in this regard, so that we have a cohesive system in terms of equitable access. Secondly, you may have gathered from my introductory slide in relation to CEPI that in order for a small organization like CEPI to achieve its fairly bold mission, it has to work with partners, as I've emphasized, but it also needs to adopt a network approach. We cannot achieve on our own, as an organization of roughly 300 people, the mechanisms and the global coordination and the global footprint required to respond to all health emergencies. So how do we do this? We adopt a network approach. So through our investments, we create a network of manufacturers, we create a network of clinical trials organizations, clinical research organizations, we create a network of regulatory organizations, and of course, at the heart of our work, we create various networks of R&D organizations. So this network approach is fundamental to how we operate, and similarly, in our advocacy and our negotiations at the towards the pandemic agreement, we've equally advocated that a network of partnerships is essential for end-to-end collaboration on medical countermeasure development and response, and for the promotion of strategic investments in economically sustainable and geographically diversified manufacturing footprint. And the latter portion around the manufacturing footprint and geodiversification of that manufacturing footprint is a key principle for us in terms of bringing manufacturing capacity closer to outbreaks wherever they may occur in the world. The third negotiating position for us was around the establishment of a multilateral system that supports rapid and efficient sharing of samples and data on pathogens with pandemic potential. And this is essential to expedite R&D in respect of medical countermeasures, as well as to bolster access through that R&D process and through the delivery process for those medical countermeasures. So this is now teasing out what Ankur referred to earlier in terms of the PABs, and I'll speak more to that shortly. We have engaged or represented our positions that I've just outlined in three ways at the INB. The first is through direct policy interventions as a relevant stakeholder. The second, we have presented ourselves as an expert organization in consultations, and we have also shared our analyses with our investors and partners so that they may equally align with us at the INB. And thirdly, we have shared practical solutions where we may have, through our existing work, been in possession of such practical solutions. So, for example, in terms of the pathogen access and benefit sharing system, we have done a lot of work on a global vaccines library and how that global vaccines library could accelerate R&D and through sharing of data, pathogen information, and someday potentially vaccine information. So all of that was gathered to support our position on the PABs and to guide partners on how we could make the PABs a reality. Next slide, please. So where do we stand currently in terms of the negotiations? So last night, a major milestone was achieved in terms of Article 9, the article that deals with research and development. For us, this article was crucial in relation to equitable access, and it's the article to which fundamentally ties our position to in terms of public funding agreements to support R&D and the access terms that those public funding agreements need to contain. So major step forward, major achievement in terms of Article 9 last night. It's largely agreed that these public funding agreements will contain equitable access terms, and there were some nuances that will be negotiated in relation to terminology, and that has been wrapped up last night. Then in terms of Article 10, which relates to manufacturing facilities and a geodiversified manufacturing footprint, we had welcomed the commitment to expand manufacturing facilities for pandemic-related products with a regional scope of operation. This is the pandemic agreement is the first international binding document that supports geographical diversification of production. And it also provides and encourages international organizations to support local manufacturing, but in the interests of a regional footprint. Article 11 on tech transfer was also mentioned by Ankur earlier. And we have welcomed the recognition of incentives or conditions linked to R&D to promote, facilitate, and incentivize transfer of technology, but also transfer of skills and know-how. That's often essential to effect a transfer of technology. And here one looks at transfer of technology, particularly supporting the global manufacturing footprint that we strive to bring into being. Next, Article 12. Arguably, the heart of the pandemic agreement is the pathogen access and benefit sharing system. This not only, CEPI's involvement here not only relates to what the pandemic agreement seeks to achieve, but also it is a crucial underpinning for our own work and a support of our own work in terms of equitable access. So commitments to rapid and efficient sharing of samples and data of pandemic potential pathogens is important to expedite research and innovation to support a health emergency response. In times of pandemic emergency, rapid access to, say, 20% of production of pandemic vaccines is important to support equitable access. Our position in terms of how much of a vaccine production is required to support the global South in an outbreak has been an area of particular contention. We believed that the provision that there should be access to 20% of production of pandemic vaccines to the WHO to effect global South access should have been a minimum. And that has been our negotiating position during the course of the INB discussions. However, the tide has shifted in terms of that minimum. And we now find, as we sit here today, that the 20% is at risk of being the ceiling in terms of donations or lower priced products being provided for global South access. So with the 20% being a minimum, we have yet to see what the negotiated floor will be, what will the new minimum be in terms of donations and low-cost access for the global South. So this is an area of huge concern and an area that we continue to monitor. Last slide, please. So to wrap up, I do want to emphasize that while the pandemic agreement negotiations command a lot of attention and they tend to subsume the multilateral focus on many occasions, there are other key developments, other key multilateral structures that in their own right contribute to the objectives of the pandemic agreement, and also support the work of the pandemic agreement, but are equally informed by the negotiations towards a pandemic agreement. And the items that are referred to, or the multilateral structures that are referred to, are listed on this slide. So one being the G20 Joint Finance and Health Task Force, which is a collaboration between health and finance ministers. And at this task force, in which CEPI is also a strong participant, we are working on the development of an operational playbook for response financing. We have done a lot of work in 2024 on the social determinants of health, which of course will have a global South focus. And we're also looking at financing solutions such as debt for health swaps and how that may benefit the global South. Secondly, the G7 is also looking at financing, but here as compared to the G20, where there's enabling work that's being conducted, the G7 is more directly looking at how you may mobilize surge financing to bring money to bear as quickly as possible to support outbreak response. And even with the Marburg response recently, we've seen that although the vaccines arrived within a few weeks, a few months, the financing arrived much later. And often having vaccines in a warehouse is a failure of the delivery system because you don't have the financing resource to get to needles in arms. And we need to look at both the delivery of the vaccines as well as the financing mechanisms to support the implementation of vaccines programs as necessarily needing to be concurrently effected. Lastly, the pandemic fund is a relatively new structure, and it was developed as largely a preparedness financing structure, financing critical gaps in PPR capacities across the world. But recently, in the Mpox outbreak, earlier I said Marburg, I actually meant Mpox. In the Mpox outbreak earlier that I've mentioned earlier, we've seen the pandemic fund pivot to supporting countries affected by the Mpox outbreak. And it did so at very rapid turnaround. It wasn't what the pandemic fund was set up to do, but it succeeded in milestone achievements in this regard, and we applaud that effort. So my final comment then in closing, as we progress through major elections across the world, we need to be vigilant to what change in political administrations means, not just for the pandemic agreement, but for the work of all the multilateral structures that I've outlined on this slide. And we hope that despite changes in administration, the fundamentals of effective response and equitable response remain topmost on the minds of the new political leaders that will greet us in 2025. Thank you very much, Amit.
Thank you. Thanks a lot, Naren, for this very, very insightful comments. But I think this is where I'll request Theda to really come in and moderate the Q&A session with the audience. And I can already see some tons of questions that are there. So very quick introduction to Theda. Theda is from Myanmar. She is the programs director with the PATH in Myanmar. And then, of course, like the most interesting thing is that she is a Fulbright scholar. And I'm sure that's an amazing achievement, and congratulations on that. And Theda is also somebody who's done her master's in public health from University of South Florida, and she's also done her diploma from Colorado State University. Hardly any other universities left in US from where she could get educated from, but she's done an amazing, very eclectic and a very, very thoughtful person. So Theda, over to you, please, for managing the Q&A session, please.
Thank you. Yeah, thank you, Amit. Yeah, so it's very fascinating, and myself learned a lot. So there are a lot of questions. So if we could not answer all the questions, we guarantee that we will respond to all these questions within 2 weeks as the FAQ. So there are a lot of questions. When I summarize, people talk about like the timeline and also, why these documents are important. So I think it will go to Anchor. So Anchor, please, response.
Thank you, Theda, and glad to see the excitement. I'd like to think that people understood, and that's why these questions. So glad. Thanks, everyone. The question is the timeline for this accord, when it might be finalized. I think the latest estimate, Sachin, this is your question. The latest estimate from the WHO is that by May 2025, there is a call to finalize this accord. I mean, that's the expected timeline, but the nature of negotiations is very complicated. It may or may not happen in that time frame because all the 190 odd countries have to sign. Not even one can say that I don't agree to this, and the pandemic accord would conclude. So that doesn't then lead to the launch of the pandemic accord. So May 2025 is the indication, but rest time will tell. Back to you, Theda.
Thank you. And people also talk about the highlight of this equal accessibility of this. So, and one question is related to how regional organization can play the role to ensure the equitable and fair access, as well as how to accomplish the success in the diverse local context. So I will hand it to Dr. Edward if you would like to comment on it. Over.
Yeah, thank you very much, Dr. Theda, and thank you for the question that was posed. Indeed, there's a role for the region organizations to play as we continue to discuss the pandemic accord. Like I spoke to, and in the Africa context, through the Africa Union and the thought leadership of Africa CDC, there is the caucus, I would call it, of the Common Africa Position, CAP, on pandemic prevention, preparedness, and response, which is really a convening of the member states. And the idea of the convening of the Africa member states who are 55 is to basically have a joint position in terms of strengthening your hand, in terms of negotiating, and based on your context, as well as ensuring that the continent's priorities are reflected in the pandemic accord. So indeed, there's a role for the regional bodies in terms of really speaking to their priorities, their context, and ensuring that is captured in the pandemic accord. And also reflecting on the lessons from COVID-19. The lessons from COVID-19, while some are common across the different regions, some are very specific to the different regions. So again, you want to bring out those specific challenges that you experience in COVID and make sure that they're sufficiently captured within the pandemic accord. So the short answer to that is yes, there's a significant role for the regional bodies. Thank you.
Thank you. So the next question is like, the importance, what are the steps of surveillance perspective to prevent the future pandemics? And also what are the process in place in the global south, to rapidly screen, identify and address emerging pathogens? So I think Sapi, Narun, it's for you. Over.
Can you hear me? Oh,
yes, we can hear you.
Okay, perfect. Thank you. Yes, so I want to emphasize first that although we're involved in surveillance activity, surveillance is not perfectly within CEPI's broader scope. It is, of course, key to inform our activities in terms of R&D and how we respond to health emergencies. So on the surveillance side, there are a number of discussions underway in terms of how countries may collaborate more effectively, both in the pandemic agreement as well as outside of the agreement. There has been some tension in terms of what are the requirements, what is the onus to be placed on countries in terms of surveillance. It hasn't been easy to align on this because, as you would be aware, countries have various levels of capacity in this regard. And when they're being held accountable, it's very difficult to try to find a fair standard. And that has been an area of contention and a path that's been difficult to navigate in multilateral structures. Nonetheless, if there's also a lot of support, though, for countries where there are gaps in terms of surveillance. The Pandemic Fund, as I've mentioned at the tail end of my presentation, has amongst its priorities support for surveillance structures. And many of the country submissions, particularly those from Africa, have been requests for funding to bolster their surveillance capabilities. And then I want to just quickly, if I may, step into the previous question, because that also ties into surveillance. Let's not also underestimate the importance of regional structures in terms of surveillance and in terms of taking surveillance data, coordinating that across multiple countries, and then determining a response. And we've seen the Africa CDC do this to effect in terms of the Mpox outbreak. And before the WHO, the Africa CDC was ready to declare an outbreak of continental concern. So that is a milestone achievement for the Africa CDC. And it also speaks to the extent to which regional organizations are powering up, are becoming bolder in terms of their role. And even though they often struggle from a resource or capacity perspective, they're not stepping back. They're being progressive and striving to do more and better. So we need to also then, in terms of local, regional, global surveillance, see a better interaction, better engagement from countries to regional structures and from regional structures to global structures. That's the pyramid that we all need to actively work at to ensure that it is more effective than it has been in the past, so that we can start the clock sooner when an outbreak presents itself, when a health emergency presents itself, and get a head start to the benefit of lives saved and economic damage mitigated. Thank you.
Thank you. Thank you for linking with the role of regional team in this too. Thank you. And another question is really exciting because we talk about Global South and then, somebody asks about Global North. So what has been the position of Global North in the pandemic accord negotiation and potentially in future accord agreements, of this nature? So I would like to open up to whoever would like to take it because it's kind of, dynamics between South and North. Yeah, over. Who would like to come first?
Thanks, Thida. I'll probably give a comment, and I'd love to hear from Naren and Edward in brief as well. I think we must recognize that it was a group of 25 countries that seeded the idea of pandemic treaty, and G7 was actually within those 25 countries, and G7 is largely all of it is Global North. So I think Global North is very positive and very active about making the negotiations work and making sure that the pandemic accord outcome is really for the benefit of the whole world. And they're cognizant of the fact that it is the Global South that tends to suffer the most. So in terms of negotiations, they are, if I may say, I think although there is a bit of a friction between the Global South and Global North in the negotiation, which is, I think, normal when about 200 humans would sit in a room and try and decide on one single landing. But I think Global North position is very supportive of Global South not facing the inequity the way it faced during the COVID-19 pandemic. So, but I think the eventual document would tell. And from the first draft, when a lot of commentaries came out where Global South was not properly, let's say, addressed, a lot of progress has been made through the negotiations, and I think the accord is heading in the right direction. Back to you, Thida, or to Naren or Edward.
I'm happy to make a few points on this. As Ankur outlined, the positions are divided substantially, and even within the Global North and the Global South constituencies, if you read them as two broad constituencies, there's a lot of division within those ranks as well. And again, I'm just trying to tie into my presentation so we don't raise too many new points and keep the discussion focused. When one looks at the elections, the changes of political administration, we expect more diversity and to enter into the mix, and alignment is going to be more difficult to achieve. So that is why there was the initial push to have this wrapped up by December, which unfortunately now is not doable. So that being said, I've also covered the difference in perspective on surveillance. So in short, the North has high standards and wants to set the bar high for surveillance, and the South is going to struggle to meet some of those requirements. So there's been a difference of opinion, and I think I've said enough on that earlier. Another area is in terms of IP, intellectual property rights. And here we find that the North has a one could call it slightly more protective leaning in terms of IP rights, and the South often views IP as a barrier to access. So you have two very extreme views, and the solution to not having these positions on IP, which then has a ripple effect for pathogen access and benefit sharing, for tech transfer, and a multitude of different clauses in the agreement, the solution that's been proposed is we try to keep the more contentious aspects of the intellectual property discussion for the World Trade Organization. But the World Trade Organization is also a multilateral organization, and with some of the political changes we're seeing in the world, those multilateral structures may be undermined because some governments are not so keen on them anymore. So we find ourselves in challenging times in the coming months in terms of trying to get to resolution as quickly as we can on these divisive issues, because the future into 2025 is becoming increasingly uncertain and will determine the success or failure, not just in terms of the pandemic agreement, but in terms of the ripple effects that it has for other issues. Thanks.
Thank you so much. Thanks for commenting all these. So the next one is the exciting topics about climate change, global warming. So how does the climate change, global warming, and food insecurity, as well as global migration, affect pandemic preparedness in global souths? So I will kind of invite Dr. Edward. We do a lot of climate change, global warming things. So first, please address for this.
Yeah, thank you very much, Dr. Thid, and I'll be asking Ankur to speak a bit more to this. You remember in the Pandemic Accord, I believe is chapter 1, I may be wrong, where they speak to One Health. So One Health is very deliberately and intentionally captured within the Pandemic Accord. And really this encompasses the human, animal, but also the climate change aspects of it. So we have in the Pandemic Accord, the One Health aspect being captured, which means there's the intention to address aspects of climate change. And with climate change, there's also the consequence of food insecurity. So the short answer from my end would be yes, that is taken care of or is going to be taken care of under the Pandemic Accord. But maybe Ankur could add to the details on that. Ankur, over to you.
Thank you, Edward. I think you rightly pointed out to One Health. May I also add the supply chain angle, because due to climate change, a lot of communities are dispersed, and there are some nations that are anyway very sort of archipelago type nations and with very difficult to reach populations. So there is a strong supply chain component within the Pandemic Accord that is trying to address some of the challenges of that part of delivering the countermeasures to the population when the countermeasures are ready as a result of very active preparedness. So I think I'd just add that to Edward's comment.
Thank you. So there is only 2 minutes left, so we need to be mindful of the time. So before we close out, there is the specific question to Narun. So will you like to take that question? What is the mission of Pandemic Fund? You had mentioned all the responses of novel outbreaks such as Mpox outbreak was not initially in the mission of the Pandemic Fund.
Yes, so the Pandemic Fund, when it was started, there was a lot of debate as to what the Pandemic Fund should be. Should it be a preparedness fund? Should it be a response fund or a search fund? And in its initial design, it was set up as a preparedness fund. So it would call for proposals and whereby countries would highlight they need support to address certain weaknesses. The current areas of focus are in terms of laboratory capacity, surveillance capacity, and workforce capacity. So it looks at those 3 areas and supporting applications for those. And what happened during the Mpox outbreak was that the fund realized it needs to have a bolder role. And it can't just sit back and watch a major outbreak unfold. And now, obviously, Mpox then evolved into a pandemic, was declared a declared a pandemic. So what it did was it quickly pivoted to provide response countries affected by mpox. But the way in which it did it, in my view, was quite clever, because it used applications that were already sent through from those countries for support, and then it worked on the basis of those. So it didn't ask countries to resubmit. While you're dealing with a crisis, you don't have time to craft another application for funding. So that was quite a powerful move by the Pandemic Fund. And if it is continuing to look at how it could be more effective in outbreak response. Sorry, the question was on the Pandemic Fund, right? I hope I heard that correctly. Okay.
Yes, correct. Yeah.
So yeah, we're part of the board, and we continue to review its strategy and how it's a new and evolving organization. But it was initially agreed it would be a preparedness fund, and now it's playing a bigger role than that. Thanks.
Thank you, Naru. So I will be over to Professor Amit for the conclusion.
Thank you, Teda. Like, this has just been a very fascinating interaction. I think all good things have to come to a close. But apologies to the audience if you had a question that was missed out. I'll request the panelists to get back to you either, because we are going to be publishing a white paper on this, interaction. So we will try to cover those questions within those in that white paper as well. So I hope you have a overall fulfilling experience. I hope you really enjoyed it, and we are very proud of the fact as Institute for Competitiveness to partner with PATH to create this Global South research collaboration, and we are looking at creating an impact across the board. And I look forward to having all of you as partners. But without further ado, I have to ask Ankur to make his final remarks and the closing remarks. And after his remarks, the session will close. So look forward to being in touch with all of you. Over to you, Ankur.
Well, thanks very much, Amit. And what a session this has been. I must say, I think the questions that have come through are really smart. And in fact, it's triggering a lot of thoughts in our own heads as well, because some of those questions are really complicated and really touch on the nerves of some really important and very touchy topics. As Amit said, we will try and respond to those as quickly as possible through email, and also in the white paper. I think it'll give us a nice context to actually write the white paper around. I think with seeing those questions and your excellent participation, everyone, I think it makes me feel that we have sort of managed to do our job reasonably well. I think the original idea of this was to simplify a very complex policy piece and deliver it to you so that you guys all understand it and start becoming a part of it, start making your contributions, your input to it, and start discussing it in your circles. And I think we have achieved that reasonably well considering the questions. But if there are any other questions that come through, please send them through email. Also, finally, just in the last minute, we will be doing this on a regular basis, the Simplified series. If you or any of your peers have any other topics in mind, please do reach out to us on the email provided in the chat, and we will try and prepare a simplified version of that and for sharing with you all in one of the future webinars. And with that, let us close, and thanks each and everyone for joining this session, and look forward to seeing you again in near future. Thank you.